I'm a specialist physiotherapist who treats women in pregnancy mainly with back pain or pelvic pain or pain anywhere in their body, generally in their pregnancy. So you might see a physiotherapist normally for a knee pain or a foot pain or a wrist pain, but this is something that I can always help with and relate to pregnancy problems as well. I also am very passionate about pelvic floor muscles in the body, and the pelvic floor muscles control urinary problems, sexual problems and bowel problems as well. So I can treat people in pregnancy with any of these problems, so sometimes incontinence, but sometimes sexual pain as well, leading up to pregnancy and birth. But I also very much see lots of people after birth with these incontinence problems, which can be a very worrying thing for many women. I receive many referrals from sexual health doctors referring patients to me with vaginal pain. So this can be multiple different diagnoses like vulvodynia, vaginismus, vestibulitis. So I help to give a physiotherapy aspect to these problems, which really means that I'm really reviewing the pelvic floor muscles and assessing those muscles to see if we can help reduce sexual pain and help women return to normal sexual function. I actually treat children with bladder problems as well as women in the early 20s who might not be pregnant, and also women after menopause or when we're getting older as well. And I strongly believe that incontinence should not be a problem at all for anybody at any age. And one of the ways that I look at pelvic floor function to assess pelvic floor is using the ultrasound machine. And ultrasound can be a great way for us to look at the bladder, the urethra, and the pelvic floor muscles. And we can also see the bowels as well, which can really show us if there are any other underlying problems. And this really helps me give a lot more information to doctors and all the other allied health professionals that might be involved in somebody's care.